Hi, this is Dr. A, and I have the first lesson in Chapter 3 of Niles, the Basics of U.S. Healthcare, and we're going to look at the government's role in U.S. healthcare. Okay, so to understand the government's role in U.S. healthcare, we have to really think about where we were before the government started to play an active part in healthcare. So the model that existed early in the country was the model of the village doctor that did house calls. People delivered babies at home, got care in their home. They might go visit a doctor at his house, but it was it was a decentralized healthcare system, basically. And then the patients that were seen by the doctor then paid the doctor for their services. So that was a pretty easy arrangement, and there was really just two people involved in that arrangement. But as healthcare started to advance and different technologies started to be implemented, like the advent of x-rays and the beginning of some of the lab testing, the healthcare industry grew, and so we had talks during the Depression and World War II. So that's like Depression is 1927, World War II is 1940 to 1945. And they were talking about wanting to start a universal healthcare program, but there were no funds for it because of those two events. And because of that, then the private sector system was developed, and as private sectors don't have to provide healthcare for everyone, they just provided healthcare for those who could pay. And so we did not get universal healthcare at that time. And the private sector developed because healthcare was developing, and so since the government wasn't willing to get on board, private industry just took it and ran with it. But the government's role of providing healthcare coverage did evolve as a regulatory body to ensure at least that the elderly and the poor were able to receive care. And so that happened with the passage of the Social Security Act of 1935 and the establishment of Medicaid and Medicare. So Medicaid is for the poor and Medicare is for the elderly. These were established in 1965, and it was mandated it was a mandate for the governments to increase their role in providing health care coverage. And so Medicare and Medicaid then became programs that were administered then at the state level, and there was funding that was provided at the federal level down to the state level, but also rules and regulations on how the funds are to be used. The next big advance was the Affordable Care Act, and it developed several governmental programs which increased the ability of individuals to make informed decisions about health care and increase access to healthcare. So that was our next really big jump into going towards universal healthcare, but also increasing the government's involvement in healthcare. So as a reminder, social regulations are usually put in by governments to focus on actions such as those in the healthcare industry that impact an individual's safety or well-being. So the example of the regulation of having to wear a seatbelt in the car is a social regulation because it limits injuries in car wrecks. But some of the acts in law that were passed, such as the Mother and Newborns Protection Act, where it dictated how long a woman is allowed to stay after vaginal delivery or after a C-section, that's another type of social regulation. But yeah, so the government is often involved in social regulations, and the regulatory healthcare power is always shared among federal and state governments. So usually federal government will set a standard or something, a regulation, and that is always the minimum. And then your state governments have to abide by the federal regulations, but they can always do more to protect or to increase the well-being of their state constituents. Local health governments often are the ones who provide the direct services, so they tend to be the boots on the ground. So they provide the immunizations, they do the inspections and things like that under the authority, of course, of the state government, and then the state government has authority, of course, delegated. Some of it with the rules delegated by the federal government. Some of the fundings come from the federal government also, but some of the funding could come from the state government, and the rules can also be state specifics. And so we're going to start with the most important federal agency with regard to health care. And this is a cabinet level, meaning at the level of the president, right? It is an executive branch, meaning part of the branch of the government that's all about getting things done, right? Enforcing laws, enforcing rules and regulations. And it's a branch, of course, of the federal government. So the U.S. Department of Health and Human Services has 11 operating divisions, which are going to be discussed in the next lesson. We'll go over all 11 of it. And the DHHS collaborates with state and local governments because many of the activities operate at the state level and the local level. And so this is where I'm stopping the lesson, and in the next lesson we're going to go more in detail about all of the different operating divisions of the DHHS. I'll see you there.